How are skin diseases treated? The treatment of skin diseases depends on the specific condition, its underlying cause, and its severity. Here are some common approaches to treating skin diseases. Topical medications. Many skin conditions are treated with topical medications applied directly to the affected skin. These can include corticosteroids. These anti-inflammatory medications can reduce redness, itching, and inflammation in conditions like eczema, psoriasis, and contact dermatitis. Topical antibiotics. Antibiotic creams or ointments are used to treat bacterial skin infections such as impetigo and folliculitis. Antifungals. Creams or ointments containing antifungal agents are used to treat fungal skin infections like athlete's foot and ringworm. Topical retinoids. Retinoid creams or gels are used to treat acne and certain other skin conditions by promoting skin cell turnover. Topical calcineurin inhibitors. These medications are used to treat inflammatory skin conditions like atopic dermatitis, eczema. Oral medications. Some skin conditions require oral medications for treatment. Examples include antibiotics. Oral antibiotics may be prescribed for more severe bacterial skin infections or conditions like acne rosacea. Antiviral drugs. Oral antiviral medications are used to treat viral infections like herpes simplex and herpes zoster, shingles. Oral antifungals. For severe or widespread fungal infections, oral antifungal medications may be necessary. Immunosuppressive drugs. In autoimmune skin diseases like pemphigus or lupus, immunosuppressive drugs may be used to control the immune system's response. Oral retinoids. Oral retinoids like isotretinoin, Accutane, are used for severe acne that doesn't respond to other treatments. Phototherapy, light therapy. Phototherapy involves exposing the skin to specific wavelengths of ultraviolet, UV, light to treat conditions like psoriasis, vitiligo, and eczema. This treatment is often performed under the guidance of a dermatologist. Lifestyle modifications. For some skin diseases, making lifestyle changes can be beneficial. These may include sun protection, avoiding excessive sun exposure and using sunscreen to prevent skin damage and reduce the risk of skin cancer. Hydration and moisturization. Keeping the skin well hydrated and using moisturizers can help manage dry skin conditions. Dietary changes. Some skin conditions may improve with dietary modifications, especially in cases of food allergies or sensitivities. Surgical procedures. In some cases, surgical procedures may be necessary to remove skin growths, lesions, or cancers. Mohs surgery is a specialized technique used to remove skin cancers with a high success rate. Biologic therapies. Biologic drugs target specific molecules in the immune system and are used to treat conditions like psoriasis and eczema when other treatments have not been effective. Physical therapy. In conditions like lymphedema or burn scars, physical therapy may be recommended to improve mobility and function. Supportive care. For chronic skin diseases, ongoing supportive care and management may be necessary to control symptoms and prevent flare-ups. This may include regular follow-up visits with a dermatologist. Behavioral therapy. For conditions like trichotillomania or dermatillomania, compulsive hair pulling or skin picking, behavioral therapy may be helpful in breaking the cycle of these behaviors. Complementary and alternative therapies. Some individuals with skin diseases explore complementary therapies such as herbal remedies, acupuncture, or aromatherapy. It's essential to discuss these options with a healthcare provider and use them alongside conventional medical treatments. The specific treatment plan will be tailored to the individual patient's needs, diagnosis, and response to treatment. It's important to consult with a dermatologist or healthcare provider for a proper diagnosis and personalized treatment recommendations for any skin condition. Self-diagnosis and self-treatment can sometimes worsen the condition or delay effective treatment. Are there conditions that put me at higher risk of developing a skin disease? Yes, there are several factors and conditions that can put individuals at a higher risk of developing various skin diseases. These risk factors can increase the likelihood of developing certain skin conditions, including genetics. Family history can play a significant role in predisposing individuals to certain skin diseases. If a close family member has had a specific skin condition, you may have a higher risk of developing the same condition. Age: some skin diseases are more common at certain stages of life. For example, acne is prevalent among adolescents, while conditions like skin cancer are more common in older adults due to cumulative sun exposure over time. Skin type: your natural skin type can influence your susceptibility to certain skin issues. For example, people with fair skin are at a higher risk of sunburn and skin cancer due to reduced melanin protection against UV radiation. Sun exposure: prolonged and excessive exposure to ultraviolet (UV) radiation from the sun or tanning beds can increase the risk of skin damage and skin cancer. Occupational hazards: certain occupations may expose individuals to irritants, chemicals, or environmental factors that can increase the risk of skin conditions, such as contact dermatitis or skin cancer. Examples include construction workers exposed to asbestos or healthcare professionals frequently washing their hands. Allergies: if you have a history of allergies, you may be at a higher risk of developing allergic skin conditions like contact dermatitis or hives. Autoimmune disorders: conditions like systemic lupus erythematosus (SLE) or rheumatoid arthritis are autoimmune diseases that can increase the risk of autoimmune skin conditions. Weakened immune system: having a weakened immune system due to conditions like HIV/AIDS, organ transplantation, or immunosuppressive medications can make you more susceptible to skin infections and certain skin diseases. Chronic medical conditions: certain chronic medical conditions, such as diabetes, kidney disease, and liver disease, can have skin manifestations or increase the risk of skin infections. Medications: some medications, such as antibiotics, can make the skin more sensitive to sunlight, leading to an increased risk of sunburn and photosensitivity reactions. Hormonal changes: fluctuations in hormone levels during pregnancy, menopause, or as a result of hormonal therapy can affect the skin and may increase the risk of conditions like melasma or acne. Stress: high levels of stress can exacerbate existing skin conditions like eczema and psoriasis or trigger new skin issues. Personal habits: lifestyle factors such as smoking or excessive alcohol consumption can negatively impact skin health and increase the risk of certain skin diseases. Obesity: obesity is associated with a higher risk of developing conditions like skin infections, hidradenitis suppurativa, and skin chafing. Excessive hygiene: overly aggressive or frequent washing of the skin can disrupt the skin's natural barrier and lead to skin problems. It's essential to be aware of these risk factors and take steps to reduce your risk, such as practicing sun protection, managing chronic medical conditions, and adopting a healthy lifestyle. Additionally, regular skin examinations and consultations with a dermatologist can help detect and address skin issues early, improving the chances of successful treatment and management. How can I prevent skin diseases? Preventing skin diseases involves adopting a combination of healthy lifestyle practices and protective measures. Here are some strategies to help you reduce the risk of skin diseases. Sun protection: protect your skin from excessive sun exposure, which is a major risk factor for skin damage and skin cancer. Use sunscreen with at least SPF 30, wear protective clothing, including wide-brimmed hats and long sleeves, and seek shade during peak sunlight hours, usually between 10 a.m. and 4 p.m. Avoid tanning beds. Tanning beds emit harmful UV radiation that can increase the risk of skin cancer. Avoid using tanning beds. Stay hydrated. Proper hydration helps maintain healthy skin. Drink an adequate amount of water daily to keep your skin well hydrated. Maintain a healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins provides essential nutrients that promote skin health. Foods high in antioxidants, such as vitamins A, C, and E, can help protect the skin from damage. Practice good hygiene. Wash your skin regularly with mild soap and water, and gently pat it dry. Avoid excessive scrubbing or harsh cleansers that can strip the skin of its natural oils. Moisturize. Use a moisturizer appropriate for your skin type to keep your skin hydrated and prevent dryness. This is especially important in dry or cold climates. Manage stress. High levels of stress can exacerbate certain skin conditions. Practice stress management techniques like deep breathing, meditation, yoga, or exercise. Avoid smoking and excessive alcohol. Smoking can prematurely age the skin and increase the risk of skin cancer. Limit alcohol consumption, as excessive alcohol can dehydrate the skin. Be cautious with hot water. Extremely hot showers or baths can strip the skin of natural oils. Use lukewarm water instead. Wear protective clothing. When working with chemicals or in occupations with potential skin hazards, wear appropriate protective clothing, gloves, and eyewear. Limit exposure to irritants. Avoid known irritants that can trigger skin conditions, such as harsh soaps, detergents, or certain cosmetics. If you have sensitive skin, opt for hypoallergenic or fragrance-free products. Allergy management. If you have known allergies, take steps to avoid allergens that can trigger skin reactions. Consult an allergist if you suspect allergies are contributing to your skin problems. Regular skin examinations. Perform self-examinations of your skin regularly to detect any changes, new moles, or suspicious growths. Seek prompt medical attention for any concerning skin changes. Stay hygienic in public areas. In public spaces like gyms and swimming pools, practice good hygiene, and use clean towels and mats to reduce the risk of skin infections. Vaccinations. Consider vaccinations that can protect against certain viral infections linked to skin diseases, such as the HPV vaccine to prevent genital warts and certain cancers. Consult a dermatologist if you have a family history of skin diseases or skin conditions. Consult a dermatologist for regular skin checks and guidance on preventive measures. Remember that preventive measures can vary based on your individual risk factors and skin type. It's essential to tailor your skincare routine and protection strategies to your unique needs. If you have specific concerns or a family history of skin diseases, consult a dermatologist for personalized guidance and skin health recommendations. Do skin diseases usually return after treatment? The recurrence of skin diseases after treatment can vary widely depending on the specific skin disease, the treatment received, and individual factors. Some skin diseases are acute and can be effectively treated with a course of medication or other interventions, with a low likelihood of recurrence. Others are chronic or recurrent by nature, requiring ongoing management to control symptoms and reduce the risk of flare-ups. Here are some factors to consider. Nature of the skin disease. Some skin diseases, like bacterial infections or certain types of rashes, can be effectively treated with antibiotics, antifungals, or corticosteroids. In these cases, the disease may resolve completely with treatment and may not recur if the underlying cause is addressed. Chronic skin diseases. Chronic skin conditions like psoriasis, eczema, atopic dermatitis, and vitiligo are characterized by recurrent flare-ups and remissions. While these conditions can often be managed effectively with treatment, they may never be completely cured, and symptoms can return periodically. Skin cancer. Skin cancer treatments, such as surgical removal or radiation therapy, aim to eliminate cancerous cells. Regular follow-up appointments and ongoing sun protection are crucial to monitor for any potential recurrence or new skin cancers. Autoimmune skin diseases. Conditions like pemphigus and bullous pemphigoid are autoimmune disorders that can be managed with immunosuppressive medications. These diseases may require long-term treatment to prevent relapses. Infectious skin diseases. Some infectious skin diseases, such as herpes simplex, cold sores, or shingles, herpes zoster, can recur when the dormant virus is reactivated. Antiviral medications can help manage symptoms and reduce recurrence. Hormonal fluctuations. Hormonal changes during pregnancy, menopause, or changes in birth control methods can trigger or worsen skin conditions like acne or melasma. Managing hormone levels can help control these conditions. Lifestyle factors. Some skin diseases are influenced by lifestyle factors. For example, acne can be aggravated by diet, stress, or skincare habits. Identifying and addressing these triggers can help prevent recurrence. Treatment adherence. proper adherence to prescribed treatments and follow-up appointments with healthcare providers is essential to prevent recurrence. Discontinuing treatment prematurely can increase the risk of relapse. Environmental factors. Exposure to allergens, irritants, or certain environmental conditions can trigger or exacerbate skin conditions. Avoiding these triggers can help prevent recurrence. Immune system health. The health of your immune system plays a role in preventing the recurrence of infectious skin diseases and autoimmune conditions. A healthy lifestyle, including adequate nutrition and sleep, can support immune function. It's important to understand that the course of skin diseases can vary from person to person, and recurrence is not guaranteed for all conditions. Consult with a dermatologist or healthcare provider for a proper diagnosis and treatment plan tailored to your specific condition. They can provide guidance on preventive measures and strategies to minimize the risk of recurrence based on your individual situation.